11 Early Signs of Liver Cirrhosis. Welcome to the Health Life channel. Cirrhosis of the liver is permanent scarring that damages your liver and interferes with its functioning. It can lead to liver failure. Cirrhosis is the result of persistent liver damage over many years. Alcohol and drugs, viruses, and metabolic factors are the most common causes. What is cirrhosis of the liver? Cirrhosis of the liver is late-stage liver disease, in which healthy liver tissue has been gradually replaced with scar tissue. This is a result of long-term chronic hepatitis. Hepatitis is inflammation in your liver, which has many causes. When inflammation is ongoing, your liver attempts to repair itself by scarring, but too much scar tissue prevents your liver from working properly. The end stage is chronic liver failure. Are there stages of cirrhosis? Cirrhosis is a progressive condition that worsens as more and more scar tissue develops. In the beginning, your body adjusts to compensate for your reduced liver function, and you might not notice it too much. This is known as compensated cirrhosis. Eventually, though, as your liver function declines further, you will begin to experience noticeable symptoms. This is known as decompensated cirrhosis. How does cirrhosis affect my liver and body? Scarring in your liver blocks the flow of blood and oxygen through your liver tissues. This slows your liver's ability to process your blood, metabolize nutrients, and filter out toxins. Cirrhosis reduces your liver's ability to produce bile and essential blood proteins. Scar tissue can also compress blood vessels running through your liver, including the important portal vein system, leading to a condition called portal hypertension. How common is cirrhosis? Cirrhosis is relatively common and is a significant cause of hospitalization and death, especially after middle age. That's because it develops gradually over time. In the United States, cirrhosis affects about 0.25% of all adults and about 0.50% of adults between the ages of 45 and 54. Each year, about 26,000 deaths in the United States are attributed to cirrhosis, and these rates are rising. Cirrhosis is a global health concern. What are the signs and symptoms of cirrhosis of the liver? Signs and symptoms of cirrhosis depend on how advanced it is. You might not have symptoms at all early on, or you might only have vague symptoms that resemble many other conditions. Symptoms of cirrhosis become more recognizable as your liver function declines. For example, you might see signs that bile isn't traveling where it needs to go and instead is overflowing into places it doesn't belong. What are the first signs of cirrhosis of the liver? Early signs and symptoms of cirrhosis may include nausea or loss of appetite, feeling weak or tired, fatigue, feeling generally ill, malaise, upper abdominal pain, especially on the right, visible blood vessels that look like spiders, spider angiomas, redness on the palms of your hands, palmar erythema. What are symptoms of advancing cirrhosis? Recognizable symptoms of cirrhosis fall into two categories: symptoms related to declining liver function and symptoms related to portal hypertension. Symptoms of stalled bile flow, like jaundice, are common indicators of declining liver function. Symptoms of portal hypertension indicate cirrhosis specifically. It's scar tissue in your liver that compresses your portal vein. Cirrhosis symptoms related to declining liver function include jaundice, yellow tint to your skin and eyes; pruritus, itchy skin but with no visible rash; dark-colored pee and light-colored poop; digestive difficulties, especially with fats; small yellow bumps of fat deposits on your skin or eyelids; unexplained weight loss and muscle loss; hepatic encephalopathy; confusion, disorientation, mood changes; motor dysfunction, twitching, tremors or lapses in muscle control; disruptions to your menstrual cycle; enlarged male breast tissue and shrunken testes in people AMAB. Cirrhosis symptoms related to portal hypertension include swelling in your abdomen, ascites; swelling in your hands, feet, legs, and/or face, edema; easy bleeding and bruising, coagulopathy; blood in your vomit or blood in your poop; low urine output from chronic kidney failure; shortness of breath from chronic respiratory failure. What causes cirrhosis of the liver? Cirrhosis is a gradual scarring process that's triggered by chronic inflammation in your liver. Any chronic liver disease that causes chronic hepatitis can lead to cirrhosis. The most common causes include Alcohol-induced hepatitis. This is chronic liver damage from chronic heavy alcohol use. Alcohol may be the most well-known cause of liver cirrhosis, but non-alcoholic causes are also common. Chronic hepatitis C infection. Hepatitis C is a viral infection that becomes chronic in most people. It's now curable with antivirals, but many people don't realize they have it. Chronic hepatitis B infection. Hepatitis B is a viral infection that may become chronic in a minority of people. If it does, you'll have it for life. It's treatable, but not curable. Less common causes of cirrhosis include autoimmune biliary disease. Certain autoimmune diseases can cause chronic liver inflammation, including autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. Genetic disorders. Certain inherited conditions can cause toxic substances to build up in your liver and damage it, such as glycogen storage disease, cystic fibrosis, and Wilson disease. Toxic hepatitis. Long-term exposure to certain environmental toxins or use of certain medications may cause chronic liver damage, including over-the-counter painkillers. Cardiovascular disease. Conditions that cause blood to build up in your liver, congestive heart failure, or that prevent blood from reaching your liver, chronic ischemia, can damage it. What are some risk factors for this condition? You might be at higher risk for cirrhosis of the liver if you are older than 50, have a history of heavy alcohol use, have a chronic viral hepatitis infection, have metabolic syndrome. What are the complications of cirrhosis? Downstream effects of cirrhosis and portal hypertension include general toxicity, feeling ill, tired, and foggy, reduced immunity, healing and recovery, fluid leakage from your veins, causing swelling in your body, hormonal imbalances and deficiencies. Life-threatening complications of cirrhosis and portal hypertension can include gastrointestinal varices and gastrointestinal bleeding, spontaneous bacterial peritonitis, kidney failure, hepatorenal syndrome, respiratory failure, hepatopulmonary syndrome, chronic liver failure, liver cancer. How is cirrhosis of the liver diagnosed? A healthcare provider will begin by physically examining you for signs and symptoms of cirrhosis of the liver. They'll ask you about when your symptoms began and whether they've changed over time. They'll also ask questions about your medical history, what medications, herbs, or supplements you take, and your diet and lifestyle. They'll follow up with medical tests to look for evidence of cirrhosis of the liver. Tests may include blood tests. A panel of liver function tests can show signs of liver disease and liver failure. These measure liver products like liver enzymes, proteins, and bilirubin levels in your blood. Blood tests may also indicate specific diseases or known side effects, like reduced blood clotting. Imaging tests. Imaging tests like an abdominal ultrasound, CT scan, or MRI can show the size, shape, and texture of your liver. A special type of imaging test called elastography uses ultrasound or MRI technology to measure the level of stiffness or fibrosis in your liver. Liver biopsy. A liver biopsy is a minor procedure to take a small tissue sample from your liver to test in a lab. A healthcare provider can usually take the sample through a hollow needle. While not always necessary, a liver biopsy can confirm cirrhosis and may help determine the cause. Reading the cause. Medications can treat certain types of liver diseases with varying levels of success. For example, antivirals can cure chronic hepatitis C, but only suppress, not cure, chronic hepatitis B. If you have toxic or alcohol-related liver disease, eliminating those toxins from your life is the only treatment. To manage this, some people may need treatment for a substance use disorder. Diet and lifestyle. Even if your liver disease is from other factors, eliminating alcohol and drugs that damage your liver will help preserve your liver longer. The same is true of metabolic stress factors. Healthcare providers recommend that anyone with any type of liver disease should try to eat healthy foods and achieve a weight that's healthy for you. In addition, some people might need dietary supplements to treat nutritional deficiencies.